Caller Antonio will be screening your calls. Do not hesitate to give him a shout out, say hello, let him know where you're calling from. And we're going to answer your healthcare questions right now. Thank you for joining us this evening. And here we go. All right. So tonight's Facebook Live broadcast, Your Health is Important. So many good things to talk about. And we're going to start off with our regular COVID update to find out about what we need to know about this coronavirus. And so a study was released yesterday that showed what Dr. Collier has been telling you for months now, that if you have had the COVID infection, if you have survived it and you now have tested positive for antibodies, you have survived the disease state, then you get your immunizations, particularly 2 of the Pfizer or the Moderna or 1 of the Johnson & Johnson. This is not including boosters, but just having had the infection, having recuperated from the infection, and then gotten the vaccinations, then you are now reaching a state of what's called super immunity. They're calling it super immunity. I said that you are a super soldier. And that means that you are as protected as you can be from this virus, from this pandemic, and from potential subsequent variants that may come down the line. Speaking of variants, there's they're calling it the stealth Omicron variant. It's BA2. BA2, stealth Omicron variant, that is a slight variation of the current Omicron. But what we're finding out is that it is more infectious. The question is, does it create a worsening state of disease? As of now, the Omicron is much more infectious than the Alpha, which was the original coronavirus, and the Delta, which was the most recent prevalent variant that was infecting everybody and causing people to be very, very sick. And so with that, we've had now the Omicron, which infecting more people, but not quite as severe disease state. So this is kind of almost a blessing from the perspective of pandemics, because you catch it, you get what's the equivalent to a cold or the flu, you recuperate from it, and you have immunity. And if you've also had your vaccines, you're a super soldier. This is what's going to get us to herd immunity, and this is what's going to convert this pandemic to an endemic infection that's possibly seasonal, and we won't have to worry about it. Now, other developments. Pfizer announced that they are producing an Omicron-specific vaccine prep product. The clinical trial started this week. And that's going to determine that vaccine is not only effective against the Omicron, but also other variants, and hopefully variants that come down the line. The science has improved over the last 2 years as far as the vaccine manufacturing is concerned. They can target things other than the spike proteins on the virus, and so we should have protection no matter which variant comes out or how it is modified. The vaccine should still give us protection. So that's our COVID virus update right now. That's where we are. We have also Moderna has announced a combination coronavirus and flu vaccine. That is, it could be a blockbuster. It just depends on how people respond to that. My personal medical opinion is that if you're going to get the coronavirus vaccine, you get the coronavirus vaccine, then 2 weeks later or 2 weeks before you get the flu vaccine. That way your body has an opportunity to work on a unique immune response for each disease state, and it's not trying to create 2 disease fighting capabilities at one time. It will do that. Your body is very effective in doing so, but what we don't want is to stress your body out like that. It's already stressed from a variety of different things, including if you have any comorbid health conditions like high blood pressure, diabetes, etc., that you would just get a more robust immune response if you give it one thing to give you immunity, then maybe 2 weeks later another, get exposed to something else. So that's my medical opinion. Is always there will be various responses to that, but again, it's a learned opinion, and it's one that makes common sense. And sometimes you have to think from the common sense perspective. If it makes sense to you, then it's probably going to make scientific sense as well. So, Antonio, let's roll and see some of the people that have tuned in already and where they've come from. I saw some names scrolling earlier.
Yeah, I got you, Doc. Now, first, before we get into these questions, people in the group have been asking literally all day about something that you asked for or you spoke about on the radio this morning, which is that Caregiver Program. Can you get a little bit more specific on that? Because I know a lot of people have been asking in the Facebook group about that.
Antonio, that is a great question. And let me tell you, this is a wonderful and amazing program that I didn't know about. Just happens that a friend of mine is one of the representatives of this federally funded program that provides a salary, basically a cash payment on a biweekly basis to people that are the primary caregiver of a family member. So if you are the daughter, the uncle, the cousin, the niece, the nephew, you can't be the spouse. Cannot be the spouse. But if you don't have to be a relative either. You can just be a caregiver. But oftentimes the caregiver is the oldest daughter in the family or a family member who basically has to put their life on hold to provide this care. They cannot work a regular job, or if they're trying to work a regular job and take care of this person that requires a care, they have no life and they're so stressed they're going to get sick themselves. So this program is provided by a company called Senior Link. The program is called Senior Link. The contact person is Mr. John Blunt, Blount, and I'll give that information out later and we'll post it. His name is Jonathan Blunt. His direct phone number, 470-716-5548. If you qualify for this program, and the qualifications are basically what I just told you, you have to be a caregiver, and you can't have a job. You can't have a primary income that exceeds a certain amount. So who doesn't meet that criteria? So a whole lot of people, this can be life changing for you. And the amount that they pay you is almost $900 every 2 weeks. So that amount on a monthly basis can literally be life changing. It can change the circumstance of anyone. The person that's sick doesn't have to worry about having funds for a caregiver. The person that's taking care of them doesn't have to worry about how am I going to survive? How am I going to take care of my family? How am I going to buy my groceries because I'm taking care of Papa and I'm not able to work because he requires, a continuous attention to almost 24/7. So you can do that. And the requirement is basically assuming that you're working or taking care of this person for at least 8 hours a day. That being the case, you call Mr. Blunt, 470-716-5548. And again, we're going to post that information. Then you give him a call, tell him you heard about us on the Your Health is Important Facebook Live broadcast, Dr. MJ Collier, and he'll get you enrolled in the program. And that's really it. It doesn't require any financial statements, no W-2 forms, none of those types of documents. This money has been designated to use and help families, and they want to get it into your hands as quickly as possible. So follow up with Mr. Blunt. Again, the program name is Senior Link, and this is for people that are caring for a loved one at home. It can be overwhelming, it can be costly, and this can be a stipend that changes your life if you are the caregiver. So there we go, Antonio. So let's get to the question. We'll go over that data again. So everybody get their pencils and papers ready, because if you don't have a family member that's doing it, you know somebody that is. Everybody has this circumstance in their family. Our parents and our grandparents are aging. They're aging in place. Nobody wants to put grandmother or grandpapa in a home. Most of the time, a family member is taking care of them on a voluntary basis. But at least on this way, you can get some kind of financial resources to help your life be better. And so that is an angel's duty. When a person has committed their life to taking care of someone who is ill, that is just really the work of God and an angel. And so if you're doing that, you need some compensation for it. And this program, it exists to do just that. So this is one of the good things that the federal government is doing. There have been a lot of good things happening. Everybody was getting checks during the coronavirus and the Paycheck Protection Plan and all those things. These funds are in that tradition. So they're there for you. This is not a handout, a giveaway from that perspective. There's no shame in accepting these funds. If you're taking care of a loved one, that is work. It is a full-time job, and this allows you to be compensated for it. So there we go, Antonio. So thank you so much for asking about the Senior Link program. John Blunt, 470-716-5548. Give him a call right now.
Okay. I got you, Doc. Well, we definitely appreciate that. I'm going to start getting the questions up now. So let's get started.
Okay, I have phlegm in my throat. It feels like draining sometimes, but I can't get it out of my throat. Please help me. Thank you. Carolyn Brink, thank you so much for tuning in. This phlegm is post-nasal drip, and it's produced by your sinus cavities, and it can either drain forward or drain backwards, depending upon where it is in your upper respiratory tract. So particularly at night, oftentimes people will, when you lay back, the congestion builds up, and then you have a lot of phlegm in your throat when you wake up in the morning. You get up, take a hot steamy shower, you spit it all out, and you're fine for the rest of the day. You can treat this a couple of ways. One, I really like nasal sprays such as Flonase or Nasacort. I was not a big proponent of nasal sprays until I used them, and upon using them, I saw that they are absolutely incredible for treating this symptom. 2 puffs in each nostril once a day. If you're having the symptom more in the morning when you wake up, do it at night before you go to bed. If your symptoms are throughout the daytime, do it in the morning when you wake up. But when you spray the spray in your nose, you spray one side, you spray the other side. You breathe a couple of times, you spray one side, you spray the other side. And you do not tilt your head back. You look at your toes and spray your nose. And that's how you can get the most effective dose in the place that it needs to be. That's part A. Part B is a non-sedating antihistamine such as Allegra, Zysol, Zyrtec, or Claritin. All of these are once daily dosing. They all come with a decongestant combination that is behind the counter, but yet over the counter. But if you're using the nasal spray and the antihistamine, you probably won't need a decongestant. That may dry you out too much and make you uncomfortably dry, so that your throat in your mouth are just too dry and you can't talk and you just feel unpleasant. So just the antihistamine itself has a decongesting effect, and the nasal spray itself will stop you from producing the mucus. If the mucus is thick, you can take a mucolytic, which makes the thick mucus thin and watery, like Mucinex. I like Mucinex DM maximum strength, 1 twice daily. These are all over-the-counter products now. They were all prescription products previously. They're over-the-counter at full prescription strength, and they can be life-changing for people that have this. And this seems to be associated also with aging. As we get older, we become phlegm producers. I don't know why that is, but it will be a great research project for somebody to find out why, as we age, we produce more phlegm. Thank you, Carolyn. Great question. Veronica Stone McNeil, I got my first shot. Do it make your blood sugar go up? No, it does not affect your blood sugar in any way. So it should not do that. Your blood sugar, your blood pressure, any of those things. Now, the stress, if you're needle phobic and you're afraid of shots, that can make your sugar go up or your blood pressure go up. But what I recommend, so that you don't have any side effects, is that you take an anti-inflammatory such as Motrin, Advil, or Aleve, and a non-sedating antihistamine that I just mentioned, the Allegra, Zyrtec, Zysol, or Claritin. Start the day before the shot. Keep taking it for at least 3 days after the shot, and you won't get any substantive side effects. You shouldn't even get a sore arm from getting it. And it does not affect your body's immune response to the vaccine. It just affects greatly your probability of having side effects from the shot. So the answer to the question is it should not make your blood sugar go up, Veronica. So you can feel safe and comfortable doing that. Okay, next question. I have thyroid. I'm on the low side. You said I need to be on the high side. Yes, you do. Billy Sue Combs. Wow. You're absolutely correct about thyroid disease. For all hormones in your body, but particularly the thyroid, which is your body's thermostat, your master gland, it controls your metabolism. So every hormone in your body has a range of normal. So if this is low and this is high and everything between my hands is normal, worst case scenario when you're getting thyroid replacement is that you want to be in the middle right here. Best case scenario, you like to push those levels up to the high side of normal. That optimizes your metabolism, keeps your body fat low, your muscle mass high, keeps your brain alert and functioning. The problem is that doctors seem to be shy about treating thyroid disease. And as soon as they get you in the normal range, if this is low, as soon as they get you here close to it, then, they stop. They don't push the dose any higher, and they should. So also there are various types of thyroid products available, including the number one most written thyroid product is a synthetic thyroid called Synthroid. But some providers, including me, think that there are better products available. There's Nature Throid, there's Armor, there's Synthroid, there's Nuthroid, New Thyroid. All of these are things that's new in you, are products that will give you, I think, better thyroid replacement and push your levels up optimally. The Synthroid, again, works wonderfully. There are people that love it. But again, you want to make sure that your doctor has you on a high enough dose. It's stepped up in increments of 12.5 micrograms. So you can ease up the dose to make sure you don't get hyperthyroid, which can cause rapid heart rate and overheating and a variety of other symptoms. But it's hard to reach that state from thyroid replacement. So you don't have to be shy about pushing the dose, and your provider should not be shy about pushing the dose. So if you're on thyroid replacement, ask them to increase the dose so that you are optimally replaced. Just say, I'd like to try a higher dose of thyroid to push me more toward the higher side of the normal range. And most people would comply with that. So, but there's a lot of good information on the internet about thyroid replacement. Just look up hypothyroidism or low thyroid, and it will give you great information about some of the options that you have, so that you're empowered with information when you go to the doctor about thyroid disease. Great question, Billy Sue. Darlene Rogers Heath, thank you so much. I have a cough I can't seem to get rid of for about 2 weeks. Start off with scratch or toggling in throat. Causes you to cough repeatedly. Sometimes you even throw up, or I try to hold it from coughing. I'm sneezing with runny eyes. Okay, thanks. I would be happy to see you. I have people that fly out from Florida all the time, but I'm also thinking about getting a satellite office in Florida. I used to have a Florida license, but I just stopped going, so I gave it up, and I shouldn't have. I should have kept it. But there is, you're sounding like you're having full-fledged allergy, but the way, again, to drive that postnatal drip in the cough, I would take the non-sedating antihistamine. Allegra would be my first choice. Zysol next, Zyrtec, and then Claritin, and also a decongestant like the Mucinex DM. I would take that for at least 2 weeks nonstop to try to establish a normal response with no itchy throat and no coughing, and to see if that takes care of it. It's also possible you could have a bronchitis, and you're going to have to treat that. Usually it can be viral, but if it persists more than 2 weeks, that means it's probably bacterial, and you're going to need some antibiotics as well. But try the Mucinex DM maximum strength. It's MUCINEX, and it comes in low strength and maximum strength. The maximum strength is only 1 pill twice daily. The low strength is 2 pills every 4 hours. That's a whole lot of Mucinex to take, and I just wouldn't want to do that. There's also a Mucinex-based cough syrup that lasts 12 hours called Delsym, DYLSM. DELYSM, Delsym, and it is amazingly good at controlling the symptoms as well. But all of these products are over the counter. You can take care of those. You just made a consultation, a telemedicine discussion with the doctor about it. So try those, and if you don't get response from those after a week or so, then you probably need to be seen by a primary care doctor. Thank you, Darlene. Great question. LaWanda Prather, this is not related to COVID-19. Okay, I am 71. Would you recommend the Shingle vaccination? The shingles vaccination is enjoying a lot of popularity right now because, one, I guess they're having commercials that are pushing it and people are asking about it. If you had chickenpox, and in your age group, you should have had chickenpox in your childhood. And if you can recall having them, then you should have lifelong immunity. The shingles is nothing but reactivation of the chickenpox varicella virus in your body, which rests in a portion of your spine called the dorsal root ganglia. And it's there and it lives there. It doesn't bother you. You don't bother it. In some people, it can cause flare-ups and give you shingles, which is defined by a vesicular rash that looks like little blisters that follow a pattern that's linear. They go along the nerve, usually along one side of the body. By definition, shingles breakouts do not cross the midline of the body. So it will be on one side of your body or the other side. If it's all over, it's not shingles. So when the shingles vaccine was first developed, people were told if you had chickenpox, and you can recall, you didn't need to get the shingles vaccine because you had natural immunity. Then the language changed to, well, if you had the chickenpox, you probably have immunity, but there's no downside to taking the shingles vaccine. If you want to take the shingles vaccine, you can. It probably won't harm you, and it will probably help you from having a shingles outbreak. Then all of a sudden it became everybody gets the shingles vaccine. So again, no downside to getting it. You do have to have a prescription to get it. If you like to get it, you need to get that from your primary care provider. There are some pharmacies in Georgia, I know, where the pharmacy has the ability, the pharmacist is licensed to order this particular vaccine and can do it. And so you might not need a doctor's prescription. I don't know what the situation is in Florida, but try it and see. And if you're interested in getting it, go ahead. Again, I'm not necessarily recommending it, but I don't think it'll be bad for you. If you ever had an outbreak of the shingles, then I definitely would recommend that you get it. Great question, LaWanda. You look great, by the way. Antonio.
Hey, I have a question from the group. So somebody asked, hello, doctor. I have your Keto Max, I have your probiotic, and I have your omega vitamins. So do you sell them individually instead of in a pack?
Absolutely. Every product that you go to the website, lipodrops.com, as you can see right there, lipodrops.com. You can order any product individually. They are packaged in groups because one, you save by ordering in multiple products at one time, and you get a better outcome by ordering products that specifically are aimed at what your particular objective is. So there's a questionnaire that you answer, and then based on your responses there, it will tell you what's the best group of things to order to obtain your objective. But the answer to the question is yes, you can get individual products on the website of any of those things. But again, it's better financial outreach to get more than one product. But you mentioned the Keto Max and the omega-3 fish oil are all great things. But if you're trying to lose weight, the combination, for instance, of the LipoDrops maximum strength formula and the Keto Max will give you greater weight loss than either product singularly. So if the objective is I want to lose more weight in a shorter period of time, then it's recommended you get more than one product. But but again, any product is available singularly. You can order them as however you like. So go to the website, lipodrops.com, take the questionnaire. And there's also medical information under one of the drop downs where a lot of the things that we talk about are posted on that site as well. So you can get great information there. So, tell all your friends, you go to it, action item, www.lipodrops.com. That's what it says, lipodrops.com. Find out how you can obtain optimal health, not just weight loss, but also the lipoimmune product to boost your immune system, and the Dr. Collier's trio for optimal health. That's what I recommend everybody take every day, no matter your situation, your age, your male, your female. If you want to stay healthy and optimize your immune system function in your GI tract, you should take every day vitamin D, omega-3 fish oil, and the probiotic formulation. Okay, next question. What do I know about the HPV vaccine? Hi, Winifred A. Winston. I know a lot about the HPV vaccine. It was originally brought out and recommended for adolescent females. Well, guess what? HPV causes the human papilloma virus, which is a precursor to a lot of cervical cancers in women, which is the reason that you get a pap smear. The point of the pap smear is to determine whether you have changes in your cervix that are consistent with cervical cancer. So it was found out that HPV is directly related to that, and an HPV infection can predispose you to cervical cancer or oral cancers. But somebody also had the epiphany, wow, if young adolescent girls are getting HPV, where are they getting it from? I wonder. Young adolescent boys. So then it was recommended that young adolescents, male and female, all get the HPV vaccine. But then they were saying, okay, it was recommended that you get it, say, between 12 and 15. And then somebody said, well, what happens if you're older than 15 and you're sexually active and you're concerned about catching HPV and possibly getting cancer from it later in life? Maybe we can use the HPV vaccine in older individuals as well. And now it is available for older individuals. If you are not in a monogamous relationship with a single partner, then you are susceptible to capturing and being infected by HPV. So the HPV vaccine is a reasonable weapon in your armamentarium to protect you from that. So if it's something you're interested in, yes, again, it's readily available. Insurances will cover it. So not a problem. HPV vaccines, human papilloma virus that protects you from the most virulent. And there are multiple strains of HPV, but there are about 8 to 15 that are associated with cancers. They call them the high risk variants of HPV, and the vaccine protects you from those high risk variants of HPV. But remember, again, there are a lot of people that are getting oral cancers, throat cancers, etc., from HPV vaccinations or HPV infections, rather, of their mouth and throat and their oral. And that's because of oral sex. Everybody's having it, everybody's doing it. And so any place that's pink and moist inside a woman's vagina, inside a man's penis, inside your mouth where it's pink and moist, then it is susceptible to the viral infection, and that's where this vaccine comes in. So more information, talk to your primary care provider or your GYN to discuss having the HPV vaccination. It's more than one shot over time. Okay. Several of my coworkers are feeling ill with stomach issues, headaches, weakness, loss of appetite, sore throat. They've gotten tested for COVID and are negative. I feel nervous being around them. Marlene, you are absolutely correct. Dr. Collier has patients that I'm seeing right now and patients that are going to the emergency rooms. They're testing negative for COVID. Now, understand this. COVID can infect your GI tract. It can infect any area in your body that's pink and wet. So most people get infections in their sinuses and their throat, but it has been found to be in the esophagus, the stomach, the small intestines, large intestines. So this could be COVID, and they're just not testing because they're swabbing your throat, and it's not in your throat, it's in your GI tract. So the only way to test for that would be to swab your rectum or do a stool specimen. So I would be nervous around them because they're calling this now a non-specific viral syndrome. Whatever that means. That means it's not bacterial, and that means and you're having infectious symptoms, so it's probably virus, but nobody has identified a viral organism that is causing this. But this is all happening in real time. It's happening in my medical community, and I'm seeing patients with this, but they're calling it a non-specific viral syndrome with all the symptoms that you described: stomach issues, headache, weakness, loss of appetite, nausea, vomiting, sore throat, diarrhea, all of those things. So again, I would not want to be around anybody that's sick in this environment. So be careful, socially distance, wear your mask, and goggles that protect your eyes as well. Great question. Jada Thrash, any suggestions on regaining senses was not due to COVID. It depends on what it was due to then, because the influenza has also been shown to cause anosmia, which is loss of sense of smell, and agusmia, which is loss of sense of taste. There are several viral illnesses that can do that. The problem is one of inflammation of the olfactory nerves and the what's called the cranial nerves. There are 7, and the cranial nerves can cause they do vision, sound, hearing, etc. So they can get inflamed, and you can have that symptomatology. So what you do, you treat the inflammation with anti-inflammatories. Natural anti-inflammatories include vitamin D and omega-3 fish oils. I would recommend taking those. I would expect to show some benefit after a couple of weeks, definitely after taking them for 1 month. And I would just keep taking them because your body is under inflammatory attack all day, every day. Bacteria, viruses, fungus infections, stress can cause inflammation in your body. Being overweight is an inflammatory process. People that are obese, and that means a BMI greater than 35, or they have high inflammatory markers in their blood. So diabetes, high blood pressure also are associated with high inflammatory markers. So you treat the inflammation. Natural things that you can do, of course, are curcumin, as you can, which is a natural Indian herb that you can take. You can spice your food with it. Turmeric will also do it. Black seed oil, a lot of your omega-3 like krill oil or the omega-3 fish oils, etc. Black seed oil, very good as a natural anti-inflammatory. So actually, it's been documented that CBD oil is also a good anti-inflammatory, also one that I recommend that you try. So I would throw any and everything at this process that is inflammation, that's anti-inflammatory, and see if it gets better. Okay, Jada, great question. Darlene, once again, can you please share the steps you did to lose weight? Like which supplements, how often? Thank you again. So Dr. Collier is now 24 pounds down as of Monday of this week. I probably lost another pound up to this point. So we'll round it up to 25. And as you can see, face is tighter, neck is, the chin that was there is gone. Collar is loose now. This process has occurred over the past, I would say 2 months. I started in December, and I started in November, December, and now we're about toward the end of January. So now we're completing 2.5, 3 months of the product. And so taking the LipoDrops Maximum formula, taking the probiotics, taking the Keto Max, things I do every day. I also take the omega-3 fish oil and the vitamin D. Those are not for weight loss, but I do take them every day. But I did those things along with intermittent fasting. That means that I eat everything that I'm going to eat within 1 8-hour period of the day. I've also cut my food portions in half. So whereas before I would eat a full serving, now I'm eating a half serving of whatever I eat, and I'm eating that within 8 hours. One of the things that I found helps tremendously, particularly when you first start, the first 3 or 4 days, you're going to have hunger. You have to embrace the hunger. You have to realize that I'm feeling hungry because I'm losing weight. And so if you don't fight that and embrace it, then you'll find that the weight loss will happen. It happens dramatically. It happens every time and everybody if you follow those guidelines. So intermittent fasting has been recommended as one of the great weight loss methodologies. It's basically going back to what we used to do back in the day when we worked all day from sun up to sundown, and you didn't eat, but you ate breakfast, lunch, but you ate it in an 8-hour period, sometimes less, and that was what you ate for the day. Now, of course, food is readily available. We can call, food delivery services, and we can eat pretty much any time of day you like. But I recommend that you try to eat any 8-hour period that fits your day. The instructions for our intermittent fasting program are on the website, lifodrops.com. It tells you how to calculate the best 8-hour period that works for you. And don't eat outside of that 8-hour period. You can, drink coffee, tea, if you like, lots of water. I cannot say that enough. But again, the weight loss works wonderfully. I'm now getting back to the weight that I have on my driver's license, which probably was the weight I was at one point. And for the past few years, I considered it an aspirational weight. But now I'm actually approaching it. So I think I'm going to settle in about 5 more pounds down. And that's what I'm going to stop trying to actively lose and just try to maintain at that point. So we're going to talk about this on this program. And I want people to join me. Tell us what your successes have been, and we want to know, what your starting weight was or how much you've lost. We don't have to know exactly the numbers. You can just say, I've lost 5 pounds, 10 pounds, 15 pounds, and over what period of time. But without question, the intermittent fasting, along with things like the Lipodrops Max and the Keto Max, will optimize your weight loss. Ernest Gibbs. Do these that are vaccinated and boosted who get COVID suffer from any long haulers issues? Thanks. Anybody that has a COVID infection can suffer from long haulers, but it doesn't seem to have been an issue. Ernest, that is a wonderful question. And at this point, I have not seen a lot of research that says people are suffering from long haulers COVID disease from breakthrough infections. But you got to understand, the breakthrough infections are happening in real time. We really won't know whether people are long hauling for a few months when they have recuperated or should have recuperated from the infection and they're still having signs and symptoms. And there are now entities, institutions, hospital systems that have COVID long hauler treatment centers. And I have a pulmonologist that I was just introduced to. He's specializing in long hauler syndrome, particularly for people that are having problems with shortness of breath and fatigue. But any symptom that people are having that is COVID related and they're calling long haulers, it can just be foggy brains, etc. There are now people that are specializing in this. They've learned about it. They're optimizing the best ways to treat these disease states. But no matter what your long hauler symptom is, the problems are all due to inflammation. So you treat inflammation with anti-inflammatories. And we talked about things like probiotics, things like omega-3 fish oils and vitamin D, all natural anti-inflammatories that will improve your health no matter what your disease state, and should help without question with COVID long haul symptoms. Great question, Ernest. Appreciate that. Okay, Janine Stepter, Houston. What is Cmos and what is it good for? Cmos is a product that's just that. It's a moss from the sea. It's full of a lot of great nutrients. It is a primary food source for a lot of sea mammals like whales, and shrimp eat them as well. A lot of fish do, but they have omega-3 fish oils in them and a lot of other proteins that are very, very good for your body's metabolism and for general overall health. Full of vitamins and great. Cmos comes in a variety of different preparations. It comes in teas, it comes in capsules, it comes in compressed tablets. So find a product that meets your criteria. Get some education from a counselor at a place like GNC or the Vitamin Shop. or just Google Cmos and find out more information about it. But it's one of the products and supplements that I do recommend as a good supplement to everything from boosting your immune system to improving your digestion. Great question, Janine. Okay. How soon can you be tested again once you tested positive for COVID to make sure you're no longer positive and infectious? Ernest, the CDC and Dr. Collier also does not recommend getting retested because you may get a test that's positive and it's a false positive. 10 to 14 days after you have had the disease state, with day one being the day you tested positive, no matter how many days you've had symptoms, day one, the day you test positive, 10 days after that, that's just the life cycle of the virus, and it goes through you and it's out of your system. You cannot give it to anybody. You do not have it any longer. You may still have symptoms, probably won't, but even if you do, your test should be negative, particularly if it is a rapid at-home test. The kind of tests that are antigen based, as ANTIGEN. These are the tests that you're hearing about that you can get 4 per family or 4 per household, free from the government. They're requiring insurance companies to pay for up to 8 tests per month under any circumstances. But that means you got to file with your insurance to get it reimbursed, or you take it to a provider that will accept insurance payments as primary payments. But the gold standard is a PCR test, and a PCR test which tests for, and it can test positive from viral fragments that are not disease causing, that can't make you sick. It's just basically dead virus or pieces of dead virus that can make your test show up positive. So not recommended necessarily that you get post testing, but there are still employers that don't understand this, and they're requiring people to get tested before they can return to work. So I would get an antigen test, a rapid test, 10 days after you test positive. It should test negative. If that test still tests positive, then I would wait at least another 5 days before I retest it, and then retest, and it should be negative definitely by that time. Great question, Ernest. You're a smart guy. Thank you so much. Okay, Marlene. Thank you very much. That is because I look younger. Thank you. That's because I shaved off my mustache. I'm giving my facial skin a rest. I do that this time of year routinely. So I usually keep the goatee and the facial hair through the Christmas holiday season and everything, all the tuxedo wearing events. And then after that, when we're doing nothing but working hard in January, I will shave and give my face a break. It also gives me about 10 to 15 minutes extra time in the morning because I don't have to line up the beard and shave the mustache and trim it and all of those things so that it doesn't look ratty. I like to present myself as being well groomed and not with a beard or a mustache that's not well trimmed and presents itself well. Thank you very much. I appreciate that. What do I do for a sore throat that has lingered for 3 weeks? Makiba, how are you? Thank you so much for tuning in. Because if you got a sore throat that's been going on for 3 weeks, it is not a virus. Viruses particularly run their course in 10 to 14 days. That means 2 weeks optimally. And the second week, you usually are feeling better and well aware that your symptoms are improving. What can happen is you can have the postnasal drip that we spoke about earlier that is predominantly an allergy problem. And then the mucus, it just is being produced by your sinus cavities, and you need to shut off that mucus production. And you can use a nasal spray such as Flonase or nasal quart, not Afrin. Afrin is a decongestant, not a steroidal nasal spray. And nasal quart and Flonase are steroidal nasal sprays that will stop the allergy response and stop the production of the mucus. And antihistamines such as Zyrtec, Zysol, Allegra, or Claritin will dry up the mucus. So you have one that slows the production and the other product that dries up the mucus. Now, if for whatever reason there is infection, if mucus is clear, then it means it usually is not infected. What it gives it color is various types of bacteria. So it can be yellow, it can be green, it can be brown. Those indicate various types of bacterial infections, from Staphylococcus to Streptococcus, etc. So if it has color to it, then you know that it's bacteria and you'll need antibiotics. If it's been going on for 3 weeks, then I would recommend taking an antibiotic as well to make sure that if there is an infection, you have cleared it up. I particularly like azithromycin because you only have to take 1 pill 1 time per day. The standard dose in a Z-Pack is 250 milligram tablets. I write a prescription for 500 milligram tablets, and I give them one a day for 4 days. The Z-Pack is 2 tablets day 1, and then 1 tablet per day, days 2 through 5, for a total of 5 days. But it's half the strength. 500 milligrams give you that extra. The great thing about this particular antibiotic, you take it for 5 days, but it stays in your system for 15 to 30 days. And it is literally a smart bomb for infection. It only goes and fights infection where there is infection. If there is no infection, it does not negatively impact. So you should not get yeast infections, particularly for women that is susceptible to yeast infections when they're treated with antibiotics, particularly antibiotics like amoxicillin, augmentin, Cephalexin or Keflex. Those are notorious for causing yeast infections in women. But other antibiotics like Cipro, Levaquin can do it as well. But the azithromycin is a smart bomb, and it rarely, if ever, causes a yeast infection. So you don't have to worry about getting the yeasties from taking that antibiotic. And it stays in your system for up to a month, and it fights sinusitis, bronchitis, pneumonia, virtually all of your respiratory pathogens. It also treats STDs like syphilis, gonorrhea, and chlamydia. Those things are all susceptible to it, and it literally cleans your body of bad infectious pathogens. So I like that antibiotic. It's user friendly and easily tolerated. Most people do. Thank you, Makiba. We appreciate you. Okay, Japika Oglesby. What product is good to treat hemorrhoids? Amazingly enough, most of the good products are over the counter, like Preparation H. They shrink the hemorrhoids. Hemorrhoids are dilated veins in your lower body. Veins are there. If you look at vasculature in your upper body, your arms, your hands, you'll see veins. I have them veins. Most people are vascular. Those veins have valves in them. And what those valves do is allow blood to only flow in one direction, which for veins is back toward your heart. So blood flow comes from your periphery, your fingertips, your legs and your feet, back to your heart. Every time your heart pumps, the blood moves forward in this manner. Well, in the vasculature, the veins around the perianal orifice, those veins are unique. They do not have valves. Now, normally blood flows in one direction, but if you sit on the toilet, the toilet seat itself will close out the veins. It's like putting a tourniquet around your leg. But also, when you increase your intra-abdominal pressure by what's called the Valsalva maneuver, that's when you sit down on the toilet and go, and you increase your abdominal pressure, that can actually cause reverse flow in the veins as well. So instead of the blood outflowing in one direction, you have blood coming back in both directions. The vein gets double full and starts to dilate and turn into a balloon-like projection. That is a hemorrhoid. Now, as long as the blood is flowing, the hemorrhoids are just there, and they can be uncomfortable, but they really don't cause any problems other than you have to wipe a few extra times when you have a bowel movement. But if a clot forms in that hemorrhoid, it's called a thrombosed hemorrhoid. The clot is called a thrombus. A thrombosed hemorrhoid causes excruciating pain. You cannot sit down on your bottom. Very unpleasant, and it has to be removed surgically. You have to open it up at least and drain the clot, remove the clot from the hemorrhoid. This is a very simple and common procedure. But there are products that contain steroids and topical anesthesias that can give you relief from hemorrhoids. But Preparation H is one. There's one that I really like. It's called the Tucks, TUCKS pads. They're little round pads, just like the ones you use to wipe your face and your skin off with. You fold it, you lay it literally up against the hemorrhoid, and it shrinks the hemorrhoid down and give you great relief. And you can use them as often as you need to. I also had a nurse when I was doing deliveries, because most pregnant women will develop hemorrhoids because the pressure of the weight of the baby on those veins causes the reverse flow as well. And so they will get dilated veins, or they will push hemorrhoids out during delivery. When they're straining to push the baby out, they can cause an acute hemorrhoidal flare. So you just take some, trying to think what the product is now. Oil. You put it on a cotton ball. You lay the cotton ball up against the hemorrhoid. You can just wear it like that. Put the cotton ball there. Pull your pants up to hold it in place, and you are good. Bless me. Sorry. Okay, so that is very, very good for that. That's witch hazel. It's the product I'm thinking of. Witch hazel that you apply to a cotton ball, lay it up against the hemorrhoid. It gives you great relief from that perspective. Okay. Okay, no more sneezing. Next question. Okay, is methambazole a good thyroid medicine? Methimazole. Yes, it is. That's one of the ones that I was recommending. But let me make sure that we're talking about the same thing here. We'll go rapidly to our what's called Hippocrates. Yeah, so that is a product that we're talking about that is one of the good substitutes versus Synthroid, which is a synthetic product. That would be one that I'd recommend as well. But again, this is a situation where you have to partner with your healthcare provider to get the best outcome in your health treatments, your medical therapies, your doctor's visits. There has to be a partnership between you, me, the provider, and you, the patient, to decide how best to treat your disease state. So you need to communicate quite well with your provider. That's the one. Now you're empowered with some information. Find out about that. Look up particularly Armor, AUMOUR. Look up also New Thyroid and Nature Thyroid. That's NU Thyroid and Nature Thyroid. Those are all good substitutes for the Synthroid. That is the most popular one because it's the number one prescription brand. It's just had most marketability, and they had the patent on it. So again, not a bad choice, but not Dr. Collier's first choice for a thyroid replacement therapy. So great. Thank you, Billy Sue. You are doing your work while you're on this program. That's the purpose of the Your Health is Important radio broadcast, for you to call and get your healthcare information. Next question. Tangi B. Taylor. What is my opinion of vegetarian or pescatarian diets, and how do you maintain appropriate iron or other nutritional levels when these diets are used? You have to be very careful when you're a vegetarian or pescatarian that, one, you're getting enough protein, and that protein needs to be between 30 and 50 grams per day of protein. And other sources of your vitamins. Your natural vitamins are oftentimes in the foods that you don't eat. So supplements are important. One, I would recommend that every person, male or female, take on a daily basis a complete multiple vitamin with iron and minerals. People take vitamins, they take individual vitamins, they take vitamin B and vitamin C and vitamin D. You need one product that has everything in it. Now, the term multiple just means more than one. It may just contain all the B complex vitamins, all the C complex vitamins, etc. So you want to make sure that the label says a complete multiple vitamin with iron and minerals. There are many of them on the market, a couple of name brands, one a day for women, one a day for men, Centrum, Zbec, all ones that I recommend. But a vitamin is a fixed chemical formula. There's no better way to make a vitamin. And when you spend more money for a vitamin, you're spending for a celebrity endorsement or a pretty bottle and label. So get the least expensive product that you can get. It's only one way to make it. It can't be made better. So it's as long as it meets that criteria, a complete multiple vitamin with iron and minerals. You can buy the one that says compare to, or compare our product, the store brand, the Target brand, the Kroger brand, the Publix brand, etc., to the name brand products that I just mentioned, and you're getting the same thing. So you should be able to get a bottle of 100 vitamins for less than $10. Everybody has a bottle of vitamins in their house right now. The problem is it's unopened and not taken. So you have to make sure that you make a regular part of your routine, taking your vitamin on a daily basis. So keep your vitamins close to your toothbrush. You brush your teeth in the morning, you take your vitamin with a full glass of water. You don't have to eat to take the vitamin. You just have to have enough water on your stomach to dissolve the vitamin, get it out of your stomach and into your system. If you take a vitamin and a lot of other medications with just a sip of water, you melt the tablet, it turns into gum. It sits on your stomach for hours. You're burping it up. You may get nausea from it. It makes you feel queasy. And you're not going to want to take it in the future. The problem is not that you're having a reaction to the medication. The problem is that your technique for taking the medication is inappropriate, and that you can now have a thick glob of gum or goo on your stomach that's highly acidic, and it's irritating the lining of your stomach. Your stomach fights this, trying to digest it by putting out more stomach acid. Now you got a stomach with plenty of acid and no food to digest. And so that stomach acid by itself in excess can cause you to have the queasies. So make sure when you take a vitamin or any other pill for that matter, full glass of water, not just a sip to get it down. That dissolves the tablet, gets it out of your stomach and into your system. So those types of diets are good for you. We are finding out that it's not necessarily as important what you eat, but more important when you eat it. And that is why, one, the intermittent fasting is becoming so popular, because it results in weight loss, and it results in and it does not result in things like high blood sugar or high cholesterol. It does not seem to negatively impact your blood pressure. If anything, it positively impacts all of those disease states by normalizing your body's own natural function. So again, I have been pescatarian and even vegetarian at various points of my life. Now I'm back to eating steaks on occasion, but I do my diet is predominated by seafood. And so seafood and veggies are what I try to do at this point to maintain good health. So that's what I recommend, Tangi. Okay, Veronica says, I'm type 2 diabetic. My doctor prescribed me levofloxacin, which is an antibiotic for sinus infection. That's when my sugar started going up, 102 to 150 and higher. How can I lower it faster? I'm barely eating anything because I'm scared. Veronica, I don't think it's the antibiotic that's making your sugar go up. I think it's the sinus infection, the inflammatory condition caused by infection of any type, usually particularly respiratory tract infections. When people get sick, they get strep throat, pneumonia, bronchitis, etc. Their blood sugar goes up. The problem is the primary infection, not the levofloxacin. Levofloxacin is a very good antibiotic. You only have to take one tablet one time per day. It covers broadly all of the GI pathogens and all of the respiratory tract pathogens, and you can take it for as few as 7 to 10 days with that. What I would recommend is that you take something to calm down and replace the good bacteria in your stomach. That would be Greek style yogurt or Activia brand yogurt, or take probiotics, any of those things, and that should help stabilize and normalize your blood sugar. But even so, blood sugar 150 is higher, but not too high. I don't consider it high until it's greater than 160. And even then, depending upon the circumstances and when you ate relative to taking that blood sugar, would I get excited about it. But 102 to 150 is not bad. It may be higher than you usually run, but those numbers aren't bad and nothing you should be concerned about. So don't be scared. Don't be afraid. Just treat that sinus infection, and that should normalize itself. But also add the probiotics to your treatment regimen. Audrey, all right. Thank you so much for tuning in. My father's 81, displaying dementia. Short-term memory is what we noticed. Long-term memory seems to be fine. All right. Thank you from Knowledge, my favorite city of all time. Great food, great fun, great place to visit. So oftentimes the first signs of dementia are short-term memory losses. People can remember things they did 20 years ago with perfect acumen. They can tell you stories, they can tell you anecdotes, they can tell you things that they did with perfect acuity. They remember every detail with no problems. But short-term memory, that's where we starting to lose brain function that retains what we did. We can't remember what we ate this morning. We can't remember whether we ate breakfast or not. We can't recall that. Or they tell you something or say something, or you tell them something, and 5 minutes later they're repeating the exact same question or don't seem to remember what you just told them. So that is one of the types of dementia. There are various types. One where the brain itself just starts to deteriorate. The other is where the blood flow and the vasculature in the brain, predominantly caused by cholesterol plaquing in the brain. That's called vascular dementia. A person can also get cholesterol that's blocking off those small, tiny arteries, and you start to get entire areas of the brain that aren't getting good blood flow. And the ones that are more readily affected are the ones associated with memory, particularly short-term memory. There are some treatments that seem to help. Again, I like natural anti-inflammatories. Probiotics seem to help as well. There is no medication for dementia that has proven to be effective. Even every product on the market that is marketed to treat dementia states as a goal that it only slows down the progression, that it doesn't improve them. It just stops them from getting worse. I'm not sure how you even measure that. The most recent medication that was released is now they're just trying to decide whether Medicare is going to cover it or not. The compromise has been that Medicare will cover it under limited circumstances, and the reason why it is so extraordinarily expensive that the benefit is being far outweighed by the cost. But there are some generic medications that are out there now that were they're still a prescription, but they were branded products before that are utilized still to treat dementia. There's one called Namenda that I really like that you can take once or twice per day. They even have a patch that you can wear to help with dementia. Everybody seems to benefit from these therapies initially. The question is, how long will you take it and how long will it continue to work for you? But short-term benefit, almost 100% of the time, people say, oh, grandmother, granddad is doing much better today after we started him on that medication. But 6 months later, they're back to baseline or worse. But you have to temper your expectations. I tell people if a person has, right now, I call them pleasantly confused, then just redirect them passively. You don't have to argue with people about things that aren't important. It doesn't matter if they say it's Friday and it's really Saturday or Thursday. That's kind of a moot point. So you don't have to worry about those sorts of things. But once they've gone from a pleasantly confused state to one where they're danger to themselves or others, they may become agitated and or even violent, then you have to intervene. And there are several medical therapies that will do that. Unfortunately, there's no magic pill in the bottle, no elixir, no shot that's going to have granddaddy balance in the checkbook. Once again, if they are no longer capable of doing that, monitor them, their activities, particularly their financial affairs, to make sure that they're keeping those things in order. Oftentimes, people have income coming in, or they'll have uncashed checks, or they're writing checks over and over for the same bill because they forgot that they paid it already. Those sorts of things. Other things are leaving the stove on, running the tub to overflow, walking out of the house or leaving the house and can't remember how to get home. These are all things that can be measured. There are some clinical tests that can evaluate status of dementia, stage of dementia, if you will, but staging doesn't change the outcome. It just gives us a more eloquent explanation of what's going on. So good luck with your dad, Audrey. We appreciate you tuning in to Your Health is Important, this broadcast. Okay. Andre Zachary, I'm experiencing pressure on each side of my throat. Then out of nowhere, I start burping. What can cause this? Sounds like you probably have either enlarged tonsils or adenoids, or you have a small throat opening that can be opened up surgically, and that can fix things. You probably are suffering from obstructive sleep apnea type symptoms as well. Find out from your significant other if you're snoring. If you're snoring, or even if you stop breathing at night, then you need to have a sleep study. Be referred to an ear, nose, and throat specialist to evaluate that. That can be dangerous. It has been associated with one, shortening of lifespan, acute heart attacks and strokes in the morning between 6 a.m. and 8 a.m. They call that waking up dead. And chronic disease states like high blood pressure, either making your blood pressure more difficult to control or uncontrollable. Blood sugar, more difficult to control or uncontrollable, but easy enough to fix and address. But sounds like you have some airway compromise that needs to be evaluated. So Andre, start off with your primary care doctor, let him look in that throat, and have him refer you to an ENT physician for a thorough examination. Okay, Antonio, last question, then we're going to close it out. Suzette Robinson, is gummy vitamins good? Suzette, if the gummy meets the criteria that I mentioned earlier, meaning it stays on the label, a complete multiple vitamin with iron and minerals all in one. Dr. Collier was not a big fan of gummy anythings, but patients seem to take them and like them. So I recommend gummy preparations as an alternative for virtually anything that you're taking. If you like gummies and gummies are available, the great thing about gummies are you don't have to have water when you take it. And it usually won't irritate your stomach the way some tablets can do because you chew it up and melt it with your own saliva. So gummy preparations are a preferred alternative for a lot of people, particularly for children that won't take pills, can't swallow pills for whatever reason. Gummies are good alternatives. And I found that even gummy preparations like CBD are very good in gummy forms. Patients love them. So yes, I'm a proponent of the gummies and the vitamins that meet that criteria. A complete multiple vitamin with iron and minerals, and you meet that. So boy, tonight has been amazing. We talked about everything from using witch hazel on hemorrhoids to thyroid replacement, optimally replacing your thyroid, weight loss methodologies with the LipoDrops maximum strength formula, the Keto Max formulation, Dr. Collier's healthy trio, taking probiotics, taking vitamin D, and taking omega-3 fish oil every day, no matter what your shortness, whatever your health status is. The lipoimmune to help boost your immune system, protect you from infections, viral infections like the flu or the coronavirus, bacterial infections such as staphylococcus and streptococcus, fungal infections such as toenail fungus and vaginal yeast. Contact Jonathan Blunt at Senior Link in reference to programs that will give you a stipend if you're a caregiver of a family member that will pay you almost $1,800 every 2 weeks. I think, no, I'm sorry, $1,800 a month, about $900 every 2 weeks. The only qualification is you can't have a full-time job, and you have to be the primary caregiver for this individual. So call Mr. Blunt, let him know what you're doing, and everybody write that number down, because if you don't need it, you have a family member that needs it. You have a friend that you know of that's in this situation, because our parents are aging, and the baby boomer generation now is at a point where they're all needing care, and this generation of children are stepping up and doing that, oftentimes at personal financial sacrifice. And this Senior Link program is specifically made to do just that. Thank you, Winfrey. We appreciate you. Thank you, Antonio, for screening all the calls and being the man that you are. Thank you for tuning in tonight, because we know you always have alternatives. We'll see you again second Wednesday of February for the Your Health is Important radio Facebook Live process. We'll see you then. And don't forget, Valentine's Day is coming up. Gentlemen, this is the time to make your dinner reservations and get your gifts and flowers ordered. Thank you so much. We'll see you next time.